Why is a biopsy used to identify ulcers? Have you ever wondered why doctors might perform a biopsy when diagnosing ulcers? Understanding this process can shed light on the complexities of peptic ulcer disease. A biopsy is a key tool used primarily to differentiate between benign and malignant ulcers. This distinction is crucial because the treatment and outcomes can vary significantly between these two types. During an upper gastrointestinal endoscopy, doctors can take small tissue samples from the ulcer site. These samples allow for microscopic examination that visual inspection alone cannot provide. Some gastric ulcers may appear benign but can have features that suggest cancer, such as irregular edges or abnormal surrounding tissue. Therefore, taking biopsy samples from the base and edges of these ulcers is essential to confirm or rule out stomach cancer. Another important reason for performing a biopsy is to detect the presence of Helicobacter pylori, a common bacterium linked to peptic ulcers. Biopsy specimens can be examined under a microscope or tested in a lab to identify this infection. Detecting H. pylori is vital because treating this infection can promote healing and reduce the chances of the ulcer returning. While there are non-invasive tests available, a biopsy during endoscopy offers a direct and specific method, especially when an endoscopy is already being done for ulcer evaluation. Biopsies can also help assess any complications related to the ulcer. For instance, they can reveal if the ulcer has penetrated into nearby organs or if there are other pathological changes that might affect treatment decisions. So, when is a biopsy performed? It is not routine for all ulcers, especially if they look clearly benign. However, a biopsy is recommended when the ulcer shows suspicious features for cancer, when the patient is at higher risk for gastric malignancy, or when confirmation of H. pylori infection is necessary. It may also be needed to rule out other diseases that mimic ulcers. In summary, a biopsy is a vital diagnostic tool in managing peptic ulcers. It helps exclude malignancy, confirms H. pylori infection, and guides appropriate treatment. This approach aligns with current medical standards, emphasizing the importance of accurate diagnosis for effective patient care. Always consult a healthcare professional for personalized advice regarding ulcers and their management.